Okay, and I'm going to probably use a lot of gestures and things to try and take the place of my visuals. I'm Jennifer Parker, and I'm linked to an outfit called the Wales Systems Forum, and we're just setting up a kind of an organisation to help extend systems understanding in Wales and link up with other like-minded people. So I'm really, really pleased to be here. My background is in education for sustainability, and also sort of philosophy and methodology and stuff like that. But I've always been, at the same time, I've always been a very committed sort of adult and community facilitator, and I love doing participatory stuff. So one of the reasons I really like systems thinking and doing it with people is that it's just such an invitation to come on a really amazing learning journey. And I hope that I'll be able to convey some of that, and that you'll be able to have a look at some of the diagrams and pictures that I so painstakingly assembled for today that we can't currently see. But hey, that's the way it goes. So so just to start off thinking about why are we dealing with systems right now? Well, we are increasingly faced, I think, we've always been faced with a complex world, full of many different interacting kinds of elements, all processing through time. This isn't anything new, really, but I think what perhaps is new, and what I'm hearing from a lot of people, is that we can't afford anymore to overlook complexity, the real complexity of the world in our organisations, where we're trying to make things better. We're trying to make interventions that are actually going to help the whole system. So we're all trying to, sort of bit like a nodal network. We know that there's a massive area of complex relationships out there. We might be working in one node of that, but what we have to try and do is to contribute to multiple joined up solutions and not transfer the problem to another part of the system. And I guess that's, I think that really resonates when you start to think about health issues. As you know, this is really one of the areas where I think joined up thinking is necessarily, in a way, ahead. We have great, innovative working from interdisciplinary teams in health. Public health is even more so, and I really first sort of really twigged the enormous interdisciplinarity and range of public health when I went along to a day's event at the University of Bristol, where I was researching leadership in the public services at the time, and the kind of support that people in public services needed. So I was interested to go along to a sort of interdisciplinary exploration between law and public health. And I sort of soon, the big takeaway for me from that day was that most of the really, really important things that happen in the world are the combination of multiple factors coming together. And that each, so if you think about attributing responsibility for events, especially events that we don't want to happen, is that it can be very, very difficult from a systems point of view, because each factor may be making, its own contribution. And particularly dramatic in this respect was somebody who was talking about famine. So what are the causes of famine, for example, are are multiple, but you can identify decisive events which tipped and perhaps an already stressed system over the edge. And we'll come back to tipping points a bit later, as they present a cause of worry and even fear, but they do also have potentially a positive side. Yeah, we'll come back to that in a bit. So I think, the sort of lesson that I took from that is that many of our structures, especially legal structures of attribution of responsibility, are very, very linear. They don't allow for multiple causes, multiple degrees of responsibility. They tend to be, you're either guilty or you're not guilty. You're not a bit guilty. And that many of our frames that we use in our society are not conducive to systems thinking. And there is a sense in which systems thinkers are continually kind of advocating for different approaches across all sorts of areas of work. But I have to say, on the plus side, yes, we do have to face up to the complexity of the world, and it can feel a bit daunting, but there are some really big pluses in all of this, which I hope to be able to just give a hint of in this relatively short presentation. And one of them is that it's an amazing knowledge journey, actually, and it's a very open and interesting one. And we are living in, as the Chinese say, rather interesting times. But they are genuinely also very interesting times, because we have amazing amounts of knowledge in different areas. What we haven't been so good at is joining those areas up. And I, along with others, see the enormous potential of systems approaches as helping create real living connections between different areas of knowledge. And I think this is a kind of step change in awareness and our ability to work in different ways that with systems. Okay, so that's a kind of bit of a and it's a lot of fun. It's a lot of fun, and we can also have confidence that our little bit is contributing to change, even if we can't see it straight away. And even that it's often very, very difficult to predict, especially social tipping points. Real sea changes of the ways that society starts doing things, but they do happen. Social tipping points do happen, and there comes a point, a sort of critical mass, where people start to see things differently, and that's often half the battle. And we'll come back to that with regard to the pandemic a little later. So I just wanted to give you a very quick sort of, probably quite personal, but varied little history of systems thinking from as I understand it. I think the systems approach was really a part of what I'd call a sort of ecological revolution. Now, I went and did philosophy of science at a master's level, and a lot of the discussion was around physics, changing ideas of physics and how they had been structured and arrived at. And the classic examples, the change from Newton to Einstein, which is really very, very interesting. However, I also took more of a maverick course, which is about the philosophy of evolutionary theory. And I didn't know it at the time, which had opened up a lot more questions, actually. I didn't know it at the time, but actually most of the rest of my career would be grappling with the life sciences in various different ways. And very much systems approaches are concerned with how we make things work and stay alive and prosper and flourish. And you know, these are the concerns of sustainability, and I have, you know, been involved in this area for a long time, and I'm going to make some connections between public health and sustainability questions, which I'm sure are, as there's an accepted strong relationship there already, but further a little later I'll try and draw that out a bit more. So we had the ecological revolution was partly about, okay, we studied animals and how their bodies worked, how the system inside the body works, and that's, for example, the flow of the blood. But ecology started to look at relational behavior and the relation between species and groups of individuals as a process over time. And the predator-prey relationship is a classic example where, you know, the prey populations blossom and develop and the predator numbers go up, and then you have a crash, and there are various sort of patterns that happen over time, which were studied and still continue to be studied by ecologists. And this was one sort of area where obviously this was very much part of the foundation of evolutionary theory, which in itself was an incredible achievement, but it's an ongoing, one of the things that's interesting about it is that it's an ongoing area of thought, which hasn't completely been, you know, solved or settled down, partly because you know, there are so many amazing open questions within it, but this is actually quite typical of the system sciences. And you know, the Darwinian sort of breakthrough in terms of understanding the development of the individual as part of a relational system which moved and developed over time was an incredible achievement. And of course, this was very much picked up on by Karl Marx, who was trying to look at the economic system and what were the dynamics and forces of the economic system. And of course, Marx was a huge fan of Darwin. And, you know, thinking about economic activity in systems terms is not just the province of the left, but also the province of the right, with philosophers such as Nozick, who looked at and wanted to emphasize the importance of the freedom of many economic agents all doing their thing, and that adding up to something vibrant and living. And, you know, so systems thinking and evolutionary approaches have really enlivened our understanding of society and economy. Further down the line, we had the development of system dynamics. And again, I would say, you know, a breakthrough which is as profound as evolutionary theory breakthrough, in that we developed, Jay Forrester and others developed methods whereby we could model these dynamic interactions, and we began to understand certain key dimensions of systems, that the kinds of features of complex systems. And just to mention a few, which we'll, you know, I was going to illustrate with a climate diagram, because systems dynamics mapping and modeling is, of course, the foundation of the Earth system sciences. And there we have many different disciplines coming together to create models of how the Earth system works, and part of which is climate, obviously, and that's part of has been finding out about climate change has been part of the driver for the development of the Earth system sciences. But the features that they have are very, are shared across the system sciences. And we'll have I'm not an expert by any means in epidemiology, but I'm going to draw some, comparisons, because we do have epidemiology is indeed a system science, and we've seen it playing out in the pandemic in a really fascinating way. So some of the features of the complex systems that we're looking at, feedbacks. So part of the concern and worry about climate change is that we can identify potential feedbacks. In other words, sort of, system drivers which create an effect which in turn makes the initial driver more effective. So we have a kind of reinforcing loop going on. And a kind of, I suppose, one that might be easily thought of is we can create our own, we try to, as humans, adapt to climate change. But one of the ways we adapt is by putting on our air conditioning systems, which is going to create more greenhouse gases, which in turn will mean that we need to use them more. So these are kind of reinforcing loops, and they happen. This is one of the things that we can identify in the complex system sciences. We also have time delays because what we're looking at is a very complex system. And so, we have an input over here. It takes time to work its way through the system and to have a system effect. And that's why, even if we manage to stop emissions tomorrow, which, we still are not remotely anywhere near that, but even if we did, we would still be dealing with adapting to the effects of historic emissions, because a certain amount of it is now baked into the system, as people say. We have to deal with it. So time delays and of course uncertainty and complexity are massive here. When I was at Bristol, I also took part in a major climate programme. At the end, I was hired as an interdisciplinary expert, and this programme was about bringing in biotic feedbacks into climate models. In other words, they were trying to bring in all the stuff from all the plants and trees that feed back into the atmosphere, and also the effect of marine feedbacks. So this was in the 2010s. And, climate models have got more complex since then, but you can imagine that with all these different elements and so many different potential elements feeding in and out of these systems, your predictions are going to be accurate within a window of uncertainty. And these windows of uncertainty are part of the system sciences. And of course, this isn't really understood because we're still working with a pretty last century, or even, last half of the last century model of what science is and what science-based policy is. And I think that sort of brings me neatly to having a few reflections on the pandemic. And in this section, I should reference my colleague Vala Ragnarsdottir, as we put together some points from in a research proposal. to do with learning from the pandemic. So what was that about? And you know, I think we're still processing a lot of this. And one of the nice pictures that I have is a sort of nice global a picture of the curve of the globe with a sort of glowing neural network going on over it. And in a way, I mean, one of the amazing and positive things about our pandemic experience was the extent of global cooperation and the knowledge flows across the world around this common problem was inspiring, and it shows you the potential that humans could achieve in terms of learning and cooperation. Okay, so to get back to the system sciences dimensions, I mean, there were many things, I think, which we were interested in and reflected upon in relation to the pandemic, not least perhaps some of the economic measures which we'd always been told were impossible suddenly became possible. Well, that was pretty interesting, and maybe that fractured a few economic myths, or perhaps in political economy, you know, what's actually possible is often more than is politically convenient perhaps to say. And we found out all sorts of really interesting things, perhaps about the importance of our human relations. We are relational creatures, and you know, what the effects of the pandemic isolation and how we made us think about valuing our relationships and possibly even revaluing what we were doing with our lives. Also, not least, people discovering the tremendous healing and calming and nurturing aspects of nature. You know, we have evolved within a natural world, and our emotional reactions to the destruction of nature are very profound. They are as deep as, you know, our reactions to violence against other humans. So we found out a lot of very interesting things. I think it's shone a light on some interesting things, including perhaps as well, who are the workers that keep things going? Who are the essential workers? And do we really care about them and reward them properly? So those were all, they're very, very cogent and important things to continue to ponder. But I wanted to focus on, perhaps in a bit more of a scientific way, that what we saw during the pandemic were the system science in action. So what we saw was the use of data, mass data, the hot development of mass data, modeling of infections and rises, and studying the effects of various different measures that were brought in. We all got used to seeing these graphs and hear politicians talking about flattening the sombrero and silly things like that. And, you know, what we were actually seeing here was not in any way you know, people being incompetent, or what we were seeing was science in action playing out before our eyes with all its uncertainties and brilliances and complexities. And I think it's very interesting to, again, you know, it's one of the things that's very interesting about systems is the ethical side of it and responsibility, as I was mentioning earlier, that I think when it comes to one of the major difficulties, I haven't seen this mentioned or discussed, but perhaps that's because I haven't looked hard enough. One of the major difficulties about the COVID inquiry is going to be that people will be expecting some of these, you know, this, I think perhaps some of this natural and inevitable uncertainty and trial and error to be judged, but that would actually, it wouldn't be fair to judge. It's not fair to judge anyone in a situation where we're all learning about something new and how it behaves. Obviously, what we can judge about is the extent to which, or a whole range of precautionary things which have been developed and put in place were just ignored for so long, so that they weren't actually there, or they were cancelled, so that they weren't there when trouble really happened. And this is a very strong message for sustainability and public health as well, is the precautionary approach. And this is an extremely important part of what I think systems can contribute, and already does contribute to understanding of what's an actual, you know, what's the responsibility of public bodies in to try to put in place precautionary measures. And also, of course, you can model, you know, as John Stern tried to do with regard to climate change. What's the cost of not putting in place precautionary measures? It's going to be vastly more than putting those measures in the first place. And I mean, one of the things about ecology, for example, is that we thought, perhaps over optimistically, that we'd stopped dealing with end of pipe. So let's wait until it all goes wrong, and then you try and do something about it down at that end. You know, you try to fix the symptoms. When you model the system, you try to address conditions higher up to ensure that the disastrous outcome doesn't happen. And this is seen as a part of public responsibility for many bodies and agencies. However, it doesn't necessarily fit terribly well with a political and democratic mindset, where, you know, especially if you have people who are going to be undermining your expenditure and say, oh, well, these people have spent piles of money on something which may never happen. Yes, but wait till it does, because you will then really be wanting these things to be in place. So we do have a bit of a tendency, perhaps, in democracies, not to throw money at anything until it all goes wrong, which, you know, is something we really need to be changing, as it can undermine us very profoundly, especially when we think about climate and biodiversity loss. So I guess that's one of the very interesting areas that I and my colleague were thinking about was, well, there's been a lot of societal learning about systems really during the pandemic, but are we capturing it? Do we have the capacity, you know, to really learn from these events? And what would it look like if we did? What would it look like if we were a learning society instead of a forgetting society? You know, and, you know, arguably there are some forces in the world who want us to forget and don't want people to learn from the past, you know, for all sorts of different self-interested reasons. But the majority of humanity needs to be learning from the past and projecting some of that learning into the future, arguably. So, okay, so that's something around that. And just to get back to, so if we could develop perhaps a different model, or an understanding, a bit more of a general understanding that actually, you know, evidence-based policy is going to have to be a much more fluid. We're going to have a much more fluid understanding of what that means, and that means extending the capacity for understanding, or on spreading the general understanding about the complex world we live in and the complexity of some of our interventions more widely, and not pretend that we have simple answers, or that, you know, we've got the policies that are going to, hey, fix that in even within, you know, 5-year term. Okay, so if we had a different model of evidence-based policy, that might be a very, very interesting. We were working towards that, perhaps. That might help us quite a lot. One of the, also, I just wanted to mention that one of the other elements of the pandemic, and I think this is, again, this is quite a familiar feature of when a system has a big shock, it can reveal aspects of the work of drivers and workings in the system which we normally don't think about, or perhaps we don't see quite so clearly. And one of the sort of inquiries that I got involved in relation to questions arising from the pandemic was to do with the greater death rates amongst ethnic minorities during the pandemic. And this was partly because I was working with an economist on a paper for the Encyclopedia of the SDGs, I think it was, to do with how do you design equality into an economy? Obviously a huge question. But in order to even begin to tackle that, we started to look at a much more complex model of, or complex unpicking of what inequality and equality means in terms of social experience and social factors. And I think, you know, this has a direct bearing on issues to do with determinants of public health. That we were looking at the relationship between discrimination, poor housing, low-paid jobs, and violence and trauma, because when you're in a discriminated group, this is what you experience. You are on edge much more of your life, anticipating the potential of violence, and you will have some forms of inherited and likely, you know, traumatic experiences if you're in a discriminated group, and that directly affects your health, as does low paid work, as does poor housing. So you already have an established low health reinforcing loop, if you like, across all these different conditions, of which discrimination is, you know, potentially a quite an important causal factor. And often the only balancing loop, if you like, the only thing that gives you potential to get out of this trap, this reinforcing trap, is education. And education is always expected to do it all by itself. And, you know, as an educator, I feel this quite strongly. You know, people would say, oh, education for sustainability has failed because look at the mess we're in. But I'd say, well, hang on, what other aspects of the system would need to change in order for that education for sustainability to actually be able to be part of a system change? And I think this is where we've always got to be looking at what other elements do we need to be working with when we're making our interventions. Can we work better with the other key elements that are necessary for us? So just to finish my story about, and I'm not claiming that this is a, a solid piece of research, but it's a conceptual, systems approaches can often give you a way of conceptualizing in diagrams how you see things actually working. And in this case, we have an already reinforcing poor health loop, and the pandemic comes in and just adds that extra bit onto that. So it's actually not surprising that the mortality figures were sadly so much higher. That's just another sort of reflection around learning from the pandemic and how these experiences can make us reflect on the hidden existing structures and systems in our society. But we did also say that.
A few more minutes, Janice.
Thank you very much. Thanks for the timekeeping. We would end up on a sort of positive note to talking about what might be the most useful areas of systems thinking and tools in the realm of public health. And obviously, again, this is a huge topic, and I do have some slides with some stuff written out more fully on them. But just to say, I mean, strategic systems can help you at strategic, operational and tactical levels, but it can also help you distinguish between them. Systems thinking, as I've sort of tried to outline, and I'm sure that most of you know, is to do with how, what are the key drivers in the system and how is it working? And if we really want to, if we come to the point where we say, okay, actually, what we've really got to do is change this system, maybe in conjunction with other forms of system change, like, for example, the food system is obviously very much linked to health. We're going to need to understand the nature of the system in order that we can make interventions which actually add up to a strategy, and to try to check that we're not leaving things out. As if we leave out parts of the system, we often leave out key system actors, and we forget about perhaps the interests of certain groups of people. But we can also, if we forget about elements, we can just transfer the problem to another space or another set of concerns or another agency to deal with. So I think strategically, it's very, very important that we can use systems strategically. We can also use systems to help make the case for precautionary and positive measures that we can move from. And here, again, there's to take a wider perspective. One of the perspectives about some of the aspects of our society and the way our economy works is that it creates a lot of failure demand, as the Wellbeing Economy Alliance puts it. Part of the reason that we have a high demand for some of what we do, in public services and public health, is because other parts of the system are actually failing. So they're creating the problems that public money then is supposed to fix. Now, can we turn this round? And I think this is the whole emphasis of the wellbeing agenda, and this is one of the strengths of the wellbeing agenda, and it's so great that it's embedded in the Welsh structures and so on. But how can we really turn that into a positive programme for health is a key, system goal. And I mean, just to say on that front that in terms of the well-being economy approach and all the stuff that is so great about Wales, but we do still have a sort of ambition and action gap, which is really quite large. And I think systems approaches and tools and analysis and joint working across many different areas, it can help to bridge some of that gap and to really make commitments to joined up wellbeing possible, look much more possible and achievable. So perhaps I should stop there. I'm sorry, very, very sorry that we've had a few hitches, but I'm now open for questions. Thank you.
Thank you very much, Jennifer. And yeah, thank you. So sorry that we couldn't show your slides, but we had added them to the chat and we will send them to the audience. And thank you for your presentation, which was really insightful, took us on a big journey there. We've got a couple of questions come in, and one that actually I was thinking about myself in the context of some of our current work in public health. So I think sometimes the challenge is, how do we actually sell some of this systems thinking to senior leaders? Because this is it's a long-term way of looking at things. It acknowledges things don't happen that quickly, when there's still a call very often to look for immediate action and immediate solutions.
Okay, so so just to say on that front, I think what you can do is there's nothing wrong with getting immediate positive results, and you need immediate positive results indeed, partly to create the social support for what you're doing. But what you can try perhaps to ensure is that your immediate results don't undermine the longer term plans that you have. So, there are ways that you can sort of check whether you're actually undermining your longer term goals. And that's what having a transitional strategy means, is that you recognize that you have to move in incremental steps and you have to get some wins along the way, but you want to ensure that those wins are actually going to help you achieve your next objectives. So that's a bit of an abstract answer, but yeah. There's nothing wrong with short-term gains, and we do need them.
But I guess it's understanding their potential, as you say, knock-on intended or unintended effects as we go through time.
Unintended effects are really, systems is great for spotting potential unintended effects. For example, and one of the students that I was involved with done a lot of work on corruption, and if you model a system, you can spot when the system would be ideal for corruption, and then you can take measures against it.
Yeah, absolutely. So we've had a reflection, which was when you were talking about that new evidence-based policy approach. I don't know if you've got any further reflections on that, particularly as you described that we're very much in a what's sometimes called sort of that VUCA, that volatile, uncertain environment that we're particularly, it's become, I guess, more noticeable now than ever.
It's noticeable. It has indeed. Yes, I think, and maybe this brings me to another dimension, which I haven't spoken so much about. Which so I'm part of the Wales System Forum, which we're just setting up, and some of my perspectives have been drawn from my other colleagues, including this one, which is that. You talk about, it's becoming much more obvious that we're in a volatile situation and things can move quite fast and it's very uncertain, and it makes people feel very uncomfortable in all sorts of different ways. That we can actually take steps to increase our resilience and capacity to deal with and process complexity and uncertainty. There are ways that we can do this, and it's partly by bringing our unconscious on side as a supportive friend, because, well, many people have known all for some time, but neuroscience has now demonstrated that, you know, much of the complex processing that the brain does for you is done in an unconscious way when you're relaxing, taking a break, out in nature, asleep, and there are many ways that you can actually curate your ability to deal with these very volatile, difficult situations. How we translate that more into discourse which wants quick wins, simple answers, and one-dimensional approaches is of course hard. And you know, I think this is one of the great things, obviously, that we've seen through populism and sort of manipulation of social media is some of the sort of rise of some of even, you know, strengthening some of this stuff, which does make it difficult. I won't deny.
Yeah, very challenging. A question from me before I just give you another question is, one of the things which we're starting to look at is use some of those techniques around system mapping. And one of the things that strikes me and I've read about is perhaps that challenge between, we can do systems mapping, but sometimes there's a bit of a disconnect between that and bringing about systems change.
Yeah.
So we can use some of these tools, but it's that bit of connecting that with our partners and people who are collaborating, and how that works. I don't know if you have any observations on that or thoughts.
Well, I could draw a little bit on some work that we're doing for the Environment Agency, because we've been commissioned to work with them to develop a transitional model that they can use, and that they understand, I think rightly, you know, that this is something that has to be considered in different timeframes. This relates as well to your previous question, that you need a long-term strategy. You know, as you say, I mean, people might get some interesting insights and maybe a few skills from a systems mapping event. But in order to really draw that out and work with it, there are many further stages and elements that are needed to turn that into a strategy and to try it out in, you know, in the actual at the operational level, and develop the capacity amongst staff and also probably strategic partners to actually engage with this stuff is a real long-term commitment. I suppose what I could say is that the potential gains are great. It's a worthy investment, because if you can get it right, then you can design with others complementary interventions which are going to give you win-win results, and ultimately perhaps the ability to achieve goals with less. And you know, but of course it's always hard to justify advanced expenditure, but isn't that part of the whole shift that we need, I think, towards positive goals of flourishing, and get away from the idea that we can only just put, you know, sticking plasters on things.
Yeah, thank you. And so a question we have here, now this is a tricky question, but given the wide breadth and depth of systems thinking and system change, is there any suggestions you would have for a specific reading, either a primer or something that gives a bit of the territory, a bit of the landscape? Yeah,
no, definitely. I think Thinking in Systems by Donella Meadows is really great.
Okay.
I also really like, and I think it resonates with people who are in public services, I like the work of John Seddon, who wrote about systems thinking in the public services. And his whole, it was a critique actually of bringing in approaches and managerialism from the private sector into the public services, which may also resonate. But I think what's really interesting about his account is that he talks about the importance of goal-driven, that, you know, public services, the outcome is flourishing people. You know, it's nothing abstract like making money. It's a goal-driven enterprise, and to that extent, it's structured in a different way. But I suppose one might ask Seddon, and I have, well, shouldn't this apply to most enterprises? I mean, shouldn't we be seeing organisations that we license to operate as essentially having a duty to contribute to overall well-being? Yeah.
Thank you. No, they're great, and we will pop those out when we, send the presentation out. So that's really good. And I know a couple of members of the audience have already made some suggestions as well, for some reading.
Right. Yeah.
So that's all
we've. More one could say on that, but obviously.
Yeah, absolutely. It's a really wide topic and breadth, and there's very different perspectives. So that's all we have time for now. I don't know, are there any final thoughts or observations you wanted to share with the audience?
We are, something I would like to share is that we are starting a Wales Systems Forum network. We are setting ourselves up as a not-for-profit to offer consultancy and training. So get in touch with us if you'd like to. We're always happy to have a chat. But you might also like to, on the presentation is an email. You can send in your details and we'll let you know, because we're going to be having online events on systems thinking, especially with regard to the Welsh context. We're going to have some regular events from different disciplinary ranges to set up a bit of a systems thinking, in community of interest. So we'd love to hear from anybody who wants to keep on talking about this crazy but fascinating and fun and game-changing stuff.
So did you say that that's on the email on the presentation, and to join the forum you can email you? Is that right? Oh, brilliant. That's really great. Well, thanks ever so much for your time today, Jeneth. Once again, apologies to our audience that we couldn't share the slides, but a really good tour around a very vast subject area. We'd be grateful if any of the audience joining the webinar, if you could complete a short evaluation. We'll be sending a link to you out, and we hope that if you're not already a member, that you join as a member of the Public Health Network Cymru. We often have really a real full range of webinars. And finally, if there's any future thoughts for webinars, then please email us and let us know. Diolch yn fawr. Thank you.